Hello friends, let us now learn some important points about the atelectasis and collapse. So now the topic for today is atelectasis and collapse. So first, before we learn about this atelectasis and collapse, first let us learn what a consolidation is and how to differentiate between a consolidation and atelectasis. Okay, so first we will see consolidation. Consolidation is a homogeneous opacity. It is a homogeneous opacity of the lung volume. It is homogeneous opacity in the lung and it is uh, almost white in color. It will be completely white. Like for example, in this image, if you see, this is an image of the lung and this whitish homogeneous is always looking, everything is looking in the same color, that is homogeneous. So completely it looks white, so it is homogeneous opacity is this whitish discoloration. This normally if you see, the lungs will be almost grayish to blackish in color. If this whitish color is seen, this is opacity. So homogeneous opacity in lung is consolidation with no loss of volume. There will be little or no loss of volume at all. And it is only seen in clinical setting. When opacity, whenever you suspect that this opacity, whenever we are suspecting that this opacity is mainly due to the debris or some fluid can be exuded or transuded, replacing the air in the lungs. Actually, if you see in the alveoli, this is the alveoli, there is air in alveoli normally. This is normal. But in any disease process, if this alveoli are actually filled with either fluid or debris, then we call it as consolidation. Here, the lungs are filled, the alveoli are filled with transudate or exudate. Then we call it as consolidation. Then, what is atelectasis? Then second, what is atelectasis? Atelectasis is also called as collapse. Atelectasis and collapse are just synonyms to each other. Atelectasis is nothing but collapse. That is, the part of lung has been collapsed. That means if you see on chest X-ray the collapse, 1 minute. So atelectasis is a collapsed lung. So if you see, there are many pictures of atelectasis which we are going to learn today. Actually, so this is a collapsed lung. Even here you have collapsed lung. We'll see the pictures in due course of time. So one important thing that you should see in atelectasis also is, in atelectasis also you will see a homogeneous opacity of the lung. It is also homogeneous opacity, number one. There are some important things. Number one, homogeneous opacity is also seen with atelectasis. Number two, there is loss of volume should be seen. Okay, evidence of loss of volume is one important thing of atelectasis. That means there should be either a displacement of fissure should be there, or there can be displacement of mediastinum. There should be displacement of fissure, mediastinum, or hilum should be there. Or you can also see that there can be either elevation of diaphragm, there can be elevation of hemidiaphragm, or there can be decrease in spaces between the ribs, elevation of hemidiaphragm, or decrease in spacing between the ribs can be seen. Okay, so all these are important characteristics of atelectasis. Now, there is one important thing is that lung consolidation will appear white, and the main reason of this lung consolidation is pneumonia. Consolidation is always the main cause is pneumonia. And remember one more important thing about this. That is, if you see it is pneumonia, it is definitely pneumonia. This picture is derived from this uh, website. Okay, please link into that website for this picture. So consolidation, we have pneumonia. Example of consolidation is pneumonia, definitely. Here it is homogeneous opacity of the lung. There is no loss of volume, that is the volume of the lobe is completely normal. But if you see in atelectasis, this is also homogeneous opacity, but here you will see that there is loss of volume. Okay, the loss of volume. Why is there loss of volume? Because here there is no air in the lungs. This is one important reason. Okay, there is no air in the lungs, and as a result, you will not see any loss of volume. Air in the not complete lung, but at least a segment of lung. That is the reason for atelectasis, that is collapse. Here, because of the loss of volume, there is displacement of fissure or mediastinum or hilum. There can be elevation of hemidiaphragm or decreased spacing between the ribs is seen. So, one more important thing is that when there is lobar collapse is very fast. If there is lobar collapse, if lobar collapse occurs rapidly, okay, if lobar collapse occurs rapidly, then one important thing is this lobe will collapse into paper-like structure, collapse into paper thin structure or slice. That means normally in atelectasis, this whiteness that you see will not be seen in this situation. So if you see here, this is the normal atelectasis picture, atelectasis of right upper lobe. You can note that the mediastinum is shifted. You can see that there is mediastinum, or actually instead of mediastinum, you can say trachea, sorry. Here you can see that the trachea is shifted to the shifted to right. Okay, and there is right lung collapse. Hmm. So this is the structure, collapse structure of right lung, right upper lung collapse, right upper lobe of lung collapse. Okay, now if you see, if this lobar collapse occurs rapidly, the collapsed lobe or even collapsed segment can become paper thin like structure or slice like structure like this, and this is called as subsegmental atelectasis. Okay, this is one thing. And sometimes if you see, the lobar collapse can sometimes lead to scarring and contraction of lobe of lung. Sometimes because of collapse, and if this collapse, so if lobar collapse, if the lobar collapse is present for long period of time, that is if it is a long standing case, then the lungs might become scarred and they can be contracted. So this contracted lobe, the lobe can become shriveled, scarred and contracted. So this lobe can be seen as small remnant of lung tissue. It is seen as small remnant of lung tissue. I tried for many X-rays, but I could not get this X-ray actually. So, so one important thing is that always we are trying to, whenever there is white mass in the lung. Okay, always and always we have to differentiate whether it is a consolidation or it is a collapse. The main way of differentiating between a consolidation and collapse is by lung volume. Loss of lung volume. Loss of lung volume is seen in collapse, but it is not seen in consolidation. And if you see, the trachea is in midline in consolidation. This is shifted in collapse. But one more important thing that we have to remember is that sometimes the consolidation of the lung is associated with collapse. And this consolidation with collapse is most commonly seen in obstructive collapse. This is about consolidation and collapse. Thank you.